Papua New Guinea is rushing to prevent the spread of polio after an outbreak was declared yesterday. Our PNG correspondent Marion Farr is in Port Moresby and joins us now. Marion, how was this virus detected?
Well, this virus was first picked up in wastewater samples collected in the city of Lae and also in environmental samples collected here in the capital, Port Moresby. Now, that prompted authorities to increase surveillance, and that's how they've managed to pick up the virus in stool samples belonging to two healthy children in Lae. Now, it's important to note that both of these children were vaccinated against polio, so they are asymptomatic. Thankfully, they haven't shown any symptoms of the virus, but those stool samples are evidence of community transmission, and therefore the WHO has declared a polio outbreak here in PNG.
So who is most at risk then now that this outbreak has been declared, Marion?
Well, polio primarily affects young people, so there are grave concerns for people under the age of 10 here in Papua New Guinea, especially those who are unvaccinated. Now, Papua New Guinea has an extremely low vaccination rate. It's believed less than 50% of the population are protected against this virus. So that's extremely concerning, and it also increases the risk of the virus rapidly spreading throughout the community here in PNG. We spoke to a UNICEF representative about the situation. Here's what she had to say.
Normally, this is a deadly virus, right? It's a virus which has no cure. So if you're immunized, no problem. And so that's why it's important for every child to be immunized.
So what's being done to contain the outbreak?
Well, the Papua New Guinean government, along with its partners, including the WHO, UNICEF and the Australian government, are mobilising a program to rapidly increase vaccination rates. This means going into some of the most remote parts of Papua New Guinea, ensuring there are cold chains set up and making sure that everyone under the age of 11 is vaccinated against polio. Even if they've had the vaccine in the past, they'll need to receive a booster. This is estimated to cost around $3 million Australian dollars. And they're also increasing surveillance and monitoring, so trying to pick up any symptoms, any cases of polio in the community. So it is extremely concerning, but there is a comprehensive plan in place to deal with this outbreak.